Is it hard for your child to sit still? Is it hard for your child to concentrate and pay attention during a math class? Does your child act without thinking first? If so, your child may have attention deficit hyperactivity disorder (ADHD). Well, hello, my name is Najah Chaker, and today I'll be speaking about ADHD and its treatment. So what is ADHD? It's a neurodevelopmental disorder that affects the executive functioning of the brain in children. ADHD symptoms are inattention, hyperactivity, and impulsivity. It affected more than 1.2 million Australians, and it is one of the most common psychiatric disorders in children and adolescents. Its prevalence in children is 5%, and it occurs 4 times more likely in males than in females. There is no one single known cause for ADHD, but research demonstrates a strong genetic connection. It is thought to be associated with dysfunction in neurotransmitter-related genes such as dopamine, 5-hydroxytryptamine, and neuroepinephrine. Hence, it's a syndrome that arises from an interaction of genetic, social, and environmental factors. So what are the types of ADHD? ADHD is separated into 3 presentations. Hyperactive impulsive presentation, which include not being able to remain seated in the classroom, talking excessively, and interrupting on others. Inattentive presentation, which include not being able to focus on details, not following through on instructions, and not seeming to listen when spoken to directly. And when the symptoms of the mentioned 2 types are equally present in the person, it's called combined. ADHD is often accompanied by impaired social adjustment, academic problems, and the high likelihood of psychiatric diagnosis, leading to lower adaptive functioning in major life activities in adulthood. So what are the possible treatment options for ADHD? Speaking of drug therapy, methylphenidate is a CNS stimulant approved for the treatment of ADHD. It inhibits the reuptake of dopamine and neuroepinephrine, increasing dopaminergic and noradrenergic activity in the prefrontal cortex. However, recent research showed that these drugs do not have effect on treating some children with ADHD due to its side effects like abdominal pain, anxiety, insomnia, decreased appetite, and headache. Thus, there remains a need for effective treatment strategies. So what if we could change the behavior of a child just by monitoring his brain waves? The human brain emits electrical activity in waves that can be measured by a device called electroencephalograph (EEG). When the results of an EEG measurement are analyzed, scientists are able to identify certain brainwave patterns recorded by the machine. There are several frequencies of brainwaves called alpha, beta, theta, and delta. Beta and theta are the ones involved in ADHD. Beta refers to a person in an awake state, normal alertness, and consciousness, while theta refers to deep relaxation, meditation, and problem solving. So what is neurofeedback therapy? It is formally called electroencephalographic EEG biofeedback and occasionally referred to as neurotherapy. It is considered as an intervention for ADHD based on findings that many individuals with ADHD show low levels of arousal in frontal brain areas with excess of theta waves and deficit of beta waves. Supporters of this treatment suggest that the brain can be trained to increase the levels of arousal, which means increase beta waves and reduce theta waves, and thereby reduce ADHD symptoms. So how does neurofeedback works? So firstly, the sensors are placed on the scalp and ears to read the brain's electrical activity. Then the brain waves are displayed on the therapist's computer and goals are set. And finally, when the brainwave activity meets the set goals, the client gets positive feedback in a visual and auditory form to guide their success with the game. Neurofeedback, like other treatments, has its own pros and cons. In terms of pros, it reduces hyperactivity, increase focus, grades, and parental consent from children's behavior, and improve attention. In terms of cons, it is expensive, time-consuming, and its benefits are not long-lasting. On another note, transcranial magnetic stimulation (TMS) is another non-drug therapy for ADHD. It is a non-invasive method of neurostimulation that is able to depolarize and hyperpolarize cortical neurons. It involves the placement of an electromagnetic coil against the scalp of the subject, which delivers brief, powerful magnetic pulses inducing electrical activity in neuronal membranes, stimulating them. As a physical therapy method, TMS has significant therapeutic effects on anxiety disorders, schizophrenia, and depression. It is a safe method, has minimum side effects, and low incidence of seizures. making it a promising method in neurostimulation. The application of successive trains of such pulses has been found to cause long-term effects on the excitability of cortical areas depending on the frequency used. For example, high-frequency TMS increases neuronal excitability and cerebral blood flow of these areas, while low-frequency reduces it. There isn't any evidence showing that TMS is clinically effective, and it is not approved by the US Food and Drug Administration. However, some studies have reported that TMS can promote the secretion of dopamine by stimulating the prefrontal lobe of the brain, thereby improving the symptoms of ADHD. The therapeutic use of TMS in ADHD lags far behind its use in other neuropsychiatric disorders such as depression. So further studies are needed for neurofeedback and TMS to detect its potential effect on treating ADHD. Hope this video gave you an overview about ADHD and its therapeutics. Thank you for watching.